Insider tip: if you want to find out more about medicine, just take a look at Wikisana.
Welcome, dear viewers, to our natural medicine format today. Today, we are going into the depths of autoimmune diseases. Above all, what tricks and possibilities are there to really bring the body back into positive regeneration? And above all, how do I deal with immunosuppressants? Can I still support the immune system? I'll be discussing all of this today with my guest, Dr. Heinz Lüscher. Stay tuned. Hello, dear Heinz. Good to have you here. Hello, Corinna.
Autoimmune diseases. It's bursting right now. It's going through the roof. So many doctors I talk to say that our practice is exploding with people coming in. What do you mean by autoimmune diseases?
Well, you're right. There's a dramatic increase everywhere in all practices, in clinics. The reason is not entirely clear. I have my suspicions, but that's not the topic today. Autoimmune diseases are very complex. They can occur anywhere from head to toe. It's about the immune system, our own immune system, attacking our own tissue. That's the current theory. I have some doubts as to whether this theory is correct. To a certain extent, yes. Now it depends on which organs are affected. The thyroid gland, for example, is what we call Hashimoto's inflammation, which is autoimmune. Multiple sclerosis, where we have disorders in the brain. Arthritis, rheumatoid arthritis, affects the joints. Inflammation in the gut, Crohn's disease or colitis on the skin, neurodermatitis. Where it takes place, where this immune disorder takes place in this organ, these are autoimmune diseases. There are probably around 100 of them.
I keep hearing the phrase from conventional medicine when people come and say that I have an autoimmune disease that is incurable and nothing can be done about it. Now I have to take L-tyroxine or cortisone or whatever for the rest of my life. What do you say to that?
Yes, that's the lesson. That's how I learned it too. With experience, when you've been involved in medicine for decades, you sometimes come to different conclusions than what you've learned.
Thank goodness. What are your findings?
That's a tricky subject because I can't promise that autoimmune diseases are easily curable. That's not the case with us either. What I can tell you from experience is that we can significantly improve them. We can always alleviate the symptoms. We have cases where autoimmune diseases have been cured, but you can never promise that. But it's worth thinking outside the box and looking at other options in addition to the usual immune suppressants. They really do exist.
I also always hear the theory that if immune suppressants are given, you should never work with immune-promoting measures. Whether it's vitamin D or, I don't know, maybe you can say something about that? What do patients come with? What is communicated in conventional medicine? What must not be combined? What should happen?
Yes, that's the case. The treating doctors, my patients, always have the specialist with them. It's a double treatment, if you like. And I hear from many patients that their treating doctor has said, yes, please don't take anything that improves the immune system because it will then counteract my medication that suppresses the immune system. I see it differently, also from experience. I can't rely on studies here, but really only on my experience. The whole immune system is never ill. The immune system is one of the most complex things. I keep trying to learn exactly how it works. I just can't do it. It's so complicated. And it's not just that this whole structure, the immune system, is sick and attacks us. This idea, it's just not true. For me, for others perhaps, but for me it's not true. So there are components of the immune system that are directed against us and which then attack our organs. But there is also a healthy part or another part of the immune system that has nothing to do with this autoimmune disease. And from this point of view, I strengthen this person, primarily the immune system. And it's also important to say that I keep hearing from colleagues that there's nothing you can do. The immune system is just there. How can you strengthen it? Well, it really is the easiest thing in the world to strengthen the immune system.
So tell me, when someone comes in with chronic illnesses, does it matter to you whether it's Hashimoto's or colitis? Is it just a matter of principle for you? How do you strengthen the immune system?
Well, of course, as I said, it's very complex, and it needs hundreds of micronutrients. But the most important ones, vitamin D, omega-3 fatty acids, magnesium, selenium, and zinc are the building blocks of the immune system. And if we always consume this, I can tell you from my own experience, you simply a lot less sick. I have not been susceptible to viruses for many years. And yes, I take these substances, and then of course, these are the basics, so you can of course take vitamin C and rechinacea and many other plants that also support this. But you can really give the immune system a helping hand, quite clearly. And that improves this autoimmune disease. That's one thing, but it's not enough.
However, there is always the discussion about whether to take something like this in a complex, isolated form, in which dosage form, liquid, or even magnesium, in which form does it actually enter the body. There are also X different types.
Yes, with magnesium, it's true. There are about 20 different magnesium salts, and you might have to find out what you tolerate well. There are always about the same ones on the market. I work with the Green Nature products, and there is a magnesium that contains 4 different salts that have different absorption times, and therefore keep the level in the blood more or less constant. That's my favorite. But that's just magnesium. It needs everything else.
There are also different forms of vitamin D and theories about it. I also have huge differences there. Sometimes it is said, really, people say, yes, 2,000 units a day, the other comes up with other data. That still seems to be a bit undefined.
So, it's highly controversial, you're right. In conventional medicine, I'm allowed to give 1,000 units a day. 1,000.
To an infant or an adult? I always think so. Well, very logical, of course.
Yes, for adults. An infant gets 100.
Oh, we give him 1,000.
In Germany, an infant gets 1,000? Wow.
Yes, dangerous.
That would already be toxic here.
Now we have to stay serious. So vitamin D?
I'm fully aware of how vitamin D is being fought and how people are being made afraid of this toxicity of vitamin D. I can only say that in Switzerland, more than 1,000 is considered toxic. Why are tablets with 5,000 units available in the supermarket if it is so toxic? Well, that's just, you have to do a bit of studying yourself. I take 5,000 in winter and 3,000 in summer. But it depends on your age. Younger people need a little less. So these are the normal doses for me, and the level in my blood is higher than what the labs say. I deliberately go higher and have had incredibly good experiences, and I go even higher for autoimmune disorders. So you can easily 10,000 units for a while, but then you have to check the blood bar. I have to check the entire calcium metabolism and kidney function, so everything under control can be given at this level.
People are sometimes in such a severe deficit. In order to fill this deficit for the time being, So we're not even in that area yet where you could say that a kidney might notice that. Or can you not go according to the theory?
I look at the kidneys. Every 3 to 6 months, when I give 10,000 or more, I look at the kidney function. With HWEF, I have never seen a kidney dysfunction, even with higher doses.
Because the deficiency is already present.
They say that over 20 nanograms per milliliter is enough. If we want to treat autoimmune diseases, then I go to 80 to 100. In other words, significantly higher than the labs normally indicate.
So what are the effects for autoimmune diseases, where you say that the patient can really see for himself, can really see for themselves in black and white, that something is changing?
That depends on the disease. In the case of Hashimoto's, where you don't notice much, you can only see it in the blood, how your thyroid gland is functioning. You don't have no symptoms per se. You don't notice anything when it gets better. If you have arthritis, you notice that the pain goes away. With ulcerative colitis, you notice that the amount of diarrhea decreases. The patient already feels something, but it takes a few months. Natural treatment does not work overnight.
Where is the first screw that you start to turn? What is the primary approach for you, especially with autoimmune diseases?
To my knowledge, almost all, certainly 95% of all autoimmune diseases are associated with a bowel disorder. I can't improve an autoimmune disease without treating the gut as well. That is so important. And that's where I start. I try to strengthen the immune system, the natural part or the healthy part, and I treat the gut as well.
Have you ever noticed that when you ask cancer patients how their bowels worked, a year before they were diagnosed, they always realize that they already had bowel problems beforehand? So it's not just autoimmune diseases, but when we notice that something is wrong in the gut, that it's simply an important factor to look there.
Absolutely, and people don't do that. My patients tell me that I've had a bit of flatulence or diarrhea on and off for 20 years, but that's not why you go to the doctor. That's true.
It's just another taboo subject. How would a really healthy bowel behave in everyday life? So that you have an idea of how it should be? Because, of course, flatulence or diarrhea, you think, okay.
You just don't take it seriously. They say everyone has it. Of course, especially on vacation, it's normal. It's allowed sometimes. But at home, during the year, there should be no intestinal disorders. So no stomach cramps, no flatulence, no diarrhea, no constipation, no food intolerances. If you tell me every time I eat salad, if I have bloating afterwards, then you have irritable bowel syndrome. And if you don't tackle this, but leave it for years, sometimes decades, then the chance of developing an autoimmune disease at some point is simply much higher.
Yes. I think what we've also been deprived of a bit is that we used to have toilets in old buildings where you could see your own stool. And in the old days, people used to take medicine, urine, and stool simply to see what their condition was like. And now you can't see anything at all. So that means we no longer have any way of getting a picture of it.
That's right. So people don't want to see it at all.
Yes, depending on how ill you are, it might make sense.
Yes, you're right. Stool observation is important. I can actually use the stool to whether my bowels are functioning normally. The stool, i.e. ideal, is always ideal if you have a bowel movement once a day. But I am aware that there are people who have a bowel movement twice a day or every 2 days. That is still possible, but basically once a day. The stool should be formed, not runny. It must not stink. And it must not float. You can check that.
Float? Okay, that's new now.
Because if it floats, it has too much fat. Then there are undigested fat residues in the stool, and then it floats to the top. So it has to sink down in the water. If this is the case, you have a healthy stool. This depends directly on the diet.
And can I then attribute the fat digestion disorder to bile or what?
It's not that easy to say. Sure, bile plays a role, all the fat-digesting enzymes, and of course, the amount of fat you have eaten. But it's not usually the fat that's the problem. So we always have to find out, when someone has intestinal disorders, what is the cause? That's not always easy. Sometimes it's objective. I have 2 seriously ill children right now. They both have an incredible intolerance to milk. Then the therapy is not so difficult. Then you have to leave out the milk. Perhaps your word here, dear parents, if the children don't drink milk, they grow in exactly the same way, and they also have enough calcium in their bones. So they do well without milk.
Yes, that's an important insight. We were just talking about the gut again. How do you restore healthy bowel function?
There is already a pattern. I have a regimen. Calming the bloating, inflammation in the bowel. Irritable bowel syndrome is an absolutely defined clinical picture. You only have to deal with it once. We know exactly how the mucous membrane is disturbed. If the flatulence is in the foreground, then I start with zeolite. Zeolite binds histamine, and this reduces the flatulence. If you don't have flatulence, you can start building up your gut right away. A good probiotic. I work with EM multiferment here. A second product, NeoVital, is an ingeniously formulated liquid that contains turmeric but is liposomal so that it is absorbed. It also contains other substances that have an anti-inflammatory effect in the intestine. The absorption capacity of the intestinal mucosa is improved again. In this way, the intestine slowly learns to function normally again over a period of months. The problem is where people give up after 3 weeks. It didn't help. I'm not taking it anymore. I always say that it takes a year to rehabilitate a bowel. You've damaged it for 20 or more years. It won't be good again in 3 weeks. I can only ever appeal to the patience that not all patients have.
Not just patience. What I also see again and again is that if you are being treated with conventional medicine for chronic illnesses, then you are completely in agreement with the idea that you have to take L-tyroxine forever, cortisone forever, or whatever. You assume that this is a permanent loop. What I realize again and again when you are in a repair process like you are repair process, that from the moment your blood sugar is fine again and the joint pain is gone, you stop taking the products overnight, which you wouldn't have done with the chemical protocols. You would have been on them for a lifetime. We also have a strange thought. I think that's also an issue, of course.
I experience that very often. It's not just about improving the products in the gut. They are already limited. Usually about a year for the intestines, but afterwards I have to eat better than before. Otherwise, it gets sick again. No question. You need a positive attitude towards myself and my diet, exercise, a healthy psyche. I have to do something about it.
What do you think about the theory that if we are so heavily poisoned by lead, aluminum, arsenic, mercury, that the autoimmune disease doesn't attack our organ at all, but the what is encapsulated in it? Here in the thyroid gland, the complete combination may still be present. Glyphosate binds wonderfully with aluminum and then settles in there. Isn't this actually an intelligent attempt to support the breakdown of toxins in the body through inflammation? But it just can't get it out because firstly, it comes back from above, and secondly, the ways and means to support our body are lacking.
Poisoning and stress, heavy metal contamination is difficult to treat. I don't know either. If you have Hashimoto's, I can't say whether you have aluminum, lead, or mercury poisoning. You can already measure it. I have seen that detoxification takes an extremely long time. Zeolite helps to remove such heavy metals. But if you want to speed it up, you would have to do chelate infusions. This is a drastic therapy, and it's not very well tolerated. That's not my specialty. But you're right, autoimmune diseases, especially with tumors, with cancer, one should look at the causes. Very often toxins are the cause.
And perhaps also an issue with fever, that we can no longer have a fever. All the metabolic processes, this detoxification option has also been taken away from us, somehow taken away from us, for unknown reasons, why we no longer have a fever.
Fever is a positive reaction of the body. The body defends itself against illness. This should not be suppressed, even if it is unpleasant.
What else is important for you to say about autoimmune diseases? What is important for patients who are now really diagnosed as incurable forever and sent home? How would you approach them now?
Those who come to me and have already been given cortisone and immunosuppression, that's where I start a therapy like the one we've just discussed. Immune system, intestines. The medication remains. And then we'll see how the disease develops over the next few months. If the disease improves significantly, which is often the case, then I start to slowly reduce the immunosuppressants. But when I'm confronted with other doctors, I'm not allowed to talk my colleagues into it. I don't tell the patient that they should stop taking it. Instead, I tell them to go back to your specialist and explain how well you're doing and that you only want to take half as much. The colleagues have to be involved and informed that things have improved. That's my approach, and sometimes it takes a year or two. But I can really encourage people. It helps. I have seen many cases of autoimmune neurodermatitis get better. Others do the same, and nothing happens for 6 months. Those are the really disappointed ones. I understand that too. But you can't give up. We have no alternative. The alternative is to swallow the medication for the rest of your life.
You know, both camps, you really do come from conventional medicine, and you also once described that it was very clear to you that you would only work with conventional medicine until the field opened up with OPC was the key topic back then, the grape seed extract, where you said it was interesting what it can do. How do you now perceive the colleagues who are still really stuck in this wheel with this narrative? Incurable, chronic, there's no other solution except this cortisone issue. Are they now approaching you a bit more and saying, I can see an improvement in a patient, what exactly are they doing? Or is it still a bit like this when someone comes in cured, you're almost offended, and throw them out the door? We've already had effects like that.
Unfortunately, it's more this reaction. Doctors ask people, are they cured, or even better, what have they done? And if the patients then say that they did something natural, then okay. But the interest is no longer so great. There are exceptions, and I am working towards this. Even when I write reports to my colleagues, I always explain, in 2 or 3 sentences, why I have now given so much vitamin D, why I have given omega-3, why I have given boswellia, frankincense, or chokeberry against inflammation. I write this to them because they don't know this, and I hope to arouse the interest of some of them. Because it burns me, because I believe we have a good medicine and it should spread.
Yes, great. Thank you, Heinz, for being here today. I wish you continued success. I hope that more colleagues will get in touch, although with the number of autoimmune diseases that are escalating right now, I think it's inevitable that even conventional doctors will be forced to try and find another solution somehow. And you definitely have a sympathetic ear for your colleagues. And yes, thank you for being here today. See you soon. Dear viewers, autoimmune diseases are becoming an increasingly important topic. And it's always great that we have doctors who dedicate themselves to this complex topic and also find solutions. And thank you very much for watching. See you soon. Bye.